Hey everyone, this is going to be a short presentation on adolescent nutrition as well as performance nutrition or sports nutrition. So in this lesson, we're going to talk about chapter 15, which discusses some of the conditions and interventions for those conditions that adolescents may experience. So a short list of these conditions may be weight issues, that they're underweight, overweight, or have obesity. We're going to discuss disordered eating, substance abuse, and some cardiovascular related conditions, in addition to sports nutrition and their participation in competitive sports. So first off, we'll discuss weight management in the adolescent group. Just like in the adult group, we see that the prevalence of overweight and obesity in adolescents has increased. This is due to a variety of reasons that include environmental, genetic, and an interaction between environmental and genetic factors. So it's always important to note that overweight and obesity isn't just this simple condition that's a choice from overeating. There's always more layers to that onion. So this shows you a list of some risk factors for overweight and obesity in the adolescent age group, and the programs that target adolescents and help to achieve a positive weight status are going to target these groups because these individuals are going to have a higher risk for developing overweight and obesity during adolescence. And again, we know that it's important to catch overweight and obesity during this critical age period because not only from a current nutritional standpoint, but we know that some of the behaviors that may lead to overweight and obesity, those behaviors and lifestyle choices that adolescents experience are going to be carried into adulthood. So some of the treatments or interventions for overweight and obesity are going to target some of those lifestyle behaviors and can help to improve them. So how do we assess weight status in overweight and obesity? We're going to look primarily at BMI because, again, although it's an imperfect tool, it gives us an indication of body composition. So we classify overweight as a BMI that is greater than the 85th percentile but lower than the 95th percentile. And then if BMI exceeds the 95th percentile, then that would be considered obesity. So we're looking at a growth chart here specifically. So again, we're still not using the BMI as we interpret it for adults, but we're going to use a growth chart for this. So here shows you some of the statistics with overweight and obesity among adolescents. And again, the reason why we want to address this issue during adolescence is because we see that the risk is going to be carried into adulthood. So a range of complications are associated with overweight and obesity. Hypertension and dyslipidemia are cardiovascular related. So high blood pressure and high blood cholesterol levels. We see insulin resistance and type 2 diabetes. These are issues with carbohydrate metabolism and can lead to elevated blood glucose levels, which can further degrade the quality of the blood vessels. That can make them more rigid and can lead to further complications with hypertension and dyslipidemia as well. On top of that, we may see some pulmonary issues, some orthopedic issues, issues with the liver. Fatty liver disease is going to become more prevalent due to the increase in overweight and obesity. So all of these are definitely directly related to overweight and obesity, but some sort of side effects of this that are more related to the psyche are body image disturbances and lower self-esteem. So among this group, we definitely want to address these issues as healthcare providers and not just look at what could kind of clinically be wrong, but also what is happening internally and mentally, because those are definitely important factors. So as far as treating overweight and obesity, we briefly discussed this previously, but we are going to first, start with prevention. That's why we have My Plate and other nutrition recommendations and goals that help to modify the diet and help to teach adolescents what a good, well-balanced diet is. So that includes adequate fruits and vegetables, limiting sweetened beverages, getting enough physical activity, so 60 minutes of physical activity daily, and limiting screen time. So all of this is going to help with balancing that energy that's consumed with the energy that is expended. That is going to help with weight management. Okay, so if we see that weight has gotten into the overweight category, some things that we're going to look at specifically are fasting lipids. ALT and AST are liver enzymes, so they can give you an idea of how well the liver is functioning, as well as a fasting glucose. That fasting glucose is important because it can help us to understand if there's an insulin resistance element to it, which could mean that we need to modify the diet in some way, as well as it can give us an indication if there's an insulin issue that could impact how easy it is for someone to maybe lose weight. So with this stage 2 level of weight management intervention, we might add in some more structured and specific guidelines or changes to these behaviors to make them a little bit, I don't want to use the word strict, but to maybe tailor these behavior goals towards this specific individual. So maybe the dietitian working with this patient can help to emphasize specific nutrient-dense foods that they can add in. They'll limit screen time to under an hour per day. Previously, the recommendation was just to limit screen time. So here we're giving like an exact time. And to minimize energy-dense foods. So when we reach stage 3 of weight management interventions, we're going to continue with some of those more structured behavior goals, but here we definitely want to include other professionals who can specialize in managing pediatric overweight and obesity. Okay, so at this point we're looking more at adolescents who have obesity, and maybe some of the stage 1 and stage 2 interventions haven't led to the desired outcomes. So at this point, the professionals who are working on this team, they may include the doctor, a registered dietitian, possibly physical therapy and occupational therapy if there's an issue that needs to be intervened regarding how the individual is able to move, as well as possibly a psychologist or a therapist in some way if there is some kind of issue related to their relationship with food. All right, so this might include more weekly visits, a sort of meal plan that helps to create a specific calorie goal, to create that calorie deficit or a negative calorie balance that may lead to weight loss. And they're going to practice more structured behavior modification. So the professionals that are going to be working on this team are trained in behavior modification, so they may take a look at the specific behaviors that may be contributing to the overweight and obesity of this individual and help that person to come up with goals and behaviors that they can adapt to help with their goal for losing weight. So stage 4 of weight management interventions are going to be our most intense or severe interventions. And I think it's important to note that these are only appropriate for those adolescents who have severe obesity with really significant comorbidity conditions. So maybe they have really severe diabetes or insulin resistance. Perhaps there's already a condition of severe fatty liver disease. So these interventions are going to deal with a low-calorie diet, meal replacements, and sometimes medication or surgery in really extreme circumstances. So I'm going to explain some of these medications and bariatric surgeries. And I just want to, before I explain this, make sure that you understand that there are some really intense ethical considerations that, that need to be addressed whenever we reach stage 4 of treatment, because we are dealing with adolescents who perhaps aren't of the adult age at this point. And there is that psychological component to our weight status. So we want to make sure that we are always including qualified professionals from multiple disciplines so that we can really have this holistic care that is provided. So there are many medications that can be used for weight loss. I think that this is becoming a bit more popular. Again, we saw there was a big surge in weight loss medications like Orlistat in the 90s. But there's more like clinics popping up that will provide these weight loss medications. So Orlistat and Metformin, both, maybe they're not, they weren't created to be used for weight loss, but it was found that their side effects included weight loss. So these are medications that may be offered or prescribed. Surgical weight loss would be the most severe intervention. And any type of surgical weight loss is known as bariatric surgery. So in order for an adolescent to be approved for a bariatric surgery would mean that they have a BMI greater than 35 with a major complication, or a BMI of greater than 40 with minor comorbidities. So this is kind of similar to the guidelines for adults as well. But again, we want to address those psychological conditions that are associated with overweight and obesity. The big thing with bariatric surgeries is that although they can have some real benefits, which you're going to see on the next slide, there are long-term dietary changes that have to be adopted for these bariatric surgeries to be successful. Okay, so these are long-term diet changes that these individuals have to adopt in order for their weight loss surgery to be successful. So some of those include limiting sugar. This can lead to malabsorption if someone's eating high concentrations of sugar, especially sugar sweetened beverages. They typically need a higher protein diet and a little bit of physical activity daily. And all of that is to help maintain that energy balance. They're always going to need a multivitamin and mineral supplement, as well as additional calcium, vitamin D, and perhaps thiamine if malabsorption is a consideration. So depending on which type of bariatric surgery the individual has and how manipulated the GI tract is, the risk for malabsorption is going to be different. So they have like just a gastric band surgery, which just they add like a short band around the top portion of the stomach, and that can be filled or drained whenever the individual wants to create that smaller stomach portion. And that is perhaps the most or the least invasive types of the bariatric surgeries. The Roux-en-Y bariatric surgery is the most invasive and is less practiced these days because it almost completely redirects the GI tract and pretty much completely bypasses the stomach and puts almost the esophagus straight to the small intestines. So what can happen with that is a lot of malabsorption, and that's one of the reasons why this surgery is less practiced today. So again, there are a lot of long-term changes that have to be adopted for these surgeries to be successful and for the patients to not experience severe nutritional deficiencies following the surgeries. But we do see that bariatric surgeries can really help with weight loss, There's literature that says people who have type 2 diabetes, as soon as they get off the table after their bariatric surgery, they are free from their type 2 diabetes. But we also see that it can improve kidney function and blood pressure as well. So again, we have to consider the ethical complications associated with bariatric surgeries and any type of really weight loss intervention that is provided to adolescents. Okay, so we're going to kind of switch gears a little bit. This is talking about the supplement use among all adolescents. This is going to lead us into the sports nutrition portion, but here we're looking at the prevalence of supplement use among all adolescents. So what we're going to most likely see that adolescents are supplementing is multivitamins, vitamin C, a B complex vitamin, calcium, iron, and vitamin E. So what's interesting about this is that the individuals who are most likely to consume supplements oftentimes have better factors related to their nutritional status. So they may have less food insecurity. Their household income is likely higher. They themselves may have greater education as well as their parents. They're probably meeting those physical activity goals. They're probably already eating a higher quality diet, and they're typically more active. So it's interesting that the adolescents, statistically speaking, who are taking supplements already have a higher nutritional status. I think it's just interesting to look at this because we should be targeting, we should be considering food first. So let's eat a more diverse diet that's including things like vitamin C and B vitamins and iron rather than reaching for these supplements. So whenever we look at teens supplementing things other than like our standard nutrients, we'll see things that maybe are a little bit more focused to changes to body composition. So here we're talking about ergogenic aids, creatine, caffeine, growth hormone, steroids. So this is going to be a little bit more common in males and peaks around 9th or 10th grade, which is a little bit surprising, but I would think after this age, they may become a little bit more satisfied with how their body looks because remember, males physically are going to develop a little bit later. So by, 10th grade, they may look more like their classmates and they may have a little bit more body satisfaction. So this, I'm just going to briefly go over some of the supplements, especially that males may use as far as performance aids or supplements that may help to improve body composition. Those are going to include different types of steroids, growth hormone, and creatine. So it's just important to note that all of these are going to have potential side effects ranging from infertility to hypertension, aggression, breast enlargement, prostate enlargement, hyperlipidemia, which is high blood cholesterol, and GI side effects. So I think those of you who are considering going into like high school coaching, teaching, any of those that are going to be dealing with adolescents specifically, I think it's important to ask the question, like, are you, using any supplements and making sure that they feel comfortable talking to you about it, because then you can, in a unbiased way, help them to navigate some of these issues, find out why it is that they're taking these supplements, because they really can be harmful. Creatine, it probably has the most literature that is supporting it in its use for sports performance. So creatine is going to be used most often for weightlifting and intense physical exercises. So less about endurance exercises and more about what muscular work is involved. Okay, so moving on to more specific about sports nutrition. we're going to see about half or more of adolescents playing at least one sport. So energy obviously is going to be in demand for these individuals, but we know that when we are creating more energy and the energy demand is higher, then the needs for vitamins and minerals are also going to increase. And then if we're putting more work on the muscles and damaging muscles through those exercises, the protein needs are going to be increased as well. So depending on the sport that's played, even the position that's played in that sport, the nutrient needs and energy needs are going to vary greatly among adolescents. So these are some questions that you may need to ask if you're ever counseling a student athlete that can help you to understand maybe what their nutritional needs and requirements are based on their level of activity. So a good rule of thumb is that competitive athletes may need anywhere from 500 to 1,500 extra calories per day. Athletes tend to think that protein is the major macronutrient for them, but really athletes don't need an excessive amount of protein more compared to a non-athlete. So we want to make sure that protein isn't supplying more than 30% of calories from the diet, because we want to be sure that we're making room for carbohydrate, which is really the most important nutrient for athletes. We're going to talk a little bit about the nutrients that may be most deficient in athletes, but we're going to really impress that on vegan athletes or diets that restrict whole food groups or calories to maintain a specific weight. So we're going to have bigger issues in sports like gymnastics and cheerleading and dance and even cross country and long endurance exercises, because either one, they have a physique that they have to maintain in order to perform their sport, or it may be just very difficult for them to consume adequate energy compared to what they're expending in their sport. So I like to show this. This is the MyPlate that is kind of tailored to the athlete, depending on not just their sport, but also what type of training they're doing that day, or if it's a competition day. So we know that athletes are going to have higher energy needs, and we should have pre-event meals and post-event meals to help replace some of the nutrients and fluid that were lost. So you can just see here how the plate is going to change from an easy training day to a moderate training day, and then to a hard training day or race day. Okay, so vegetables and fruits are going to be required for all athletes in almost higher amounts than non-athletes, because again, we're going to have higher need for vitamins and minerals because the energy demand is higher. So always are important, fruits and vegetables. You see that lean protein is pretty consistent across all of the types of training, okay? So again, protein isn't the critical nutrient that carbohydrates are, okay? So as intensity increases, we see that carbohydrates or grains are going to get larger, all right? That is because carbohydrates are so critical in replenishing glycogen stores and also escorting proteins into the skeletal muscle. If we didn't have protein, it would be hard for, if we didn't have carbohydrates, it would be hard for our protein to make it to our muscle to be able to repair it following an event. Okay, so this is a little bit more on training diets. Carbohydrate loading is a common practice that's used to improve glycogen content of the muscles so that the muscles have that quick energy. This is something that has to be done for up to a week before an event for it to be successful, for us to be able to store that glycogen. And again, as carbohydrate needs increase, intensity is going to increase. Again, we want to make sure that we're not specifically focusing on high protein diets. Protein is definitely important for athletes, but if we emphasize protein too much, we may be increasing fat and saturated fat intake because they're likely going to be eating more meats that contain saturated fat, but we're also going to be eating so much protein that maybe we're not meeting our carbohydrate needs. So we also need more water to metabolize protein, to digest and metabolize protein, so it can also be harder to meet fluid needs for athletes if they're over-consuming protein. So we are going to look in just a little second at some of the nutrients that are of concern for athletes. Calcium and fluid, of course, are two of those nutrients. So we're going to talk specifically about female athletes in just a second. But calcium, of course, is important for bone health. And then fluid and dehydration is important because it helps to reduce the risk of injuries, and it helps to lower the body temperature, and it helps keep our muscles safe as well from injury. Okay, so calcium, iron, folate, vitamin B6, and zinc are common deficiencies that we see in athletes. If calcium is deficient in an athlete, we may see an increased risk of fractures or bone injuries. Iron is a nutrient of concern, especially in runners and in female athletes. So when runners hit their heel on the pavement, they are actually sort of degrading the red blood cells in which iron is joined to. And so that can actually deplete iron stores just from that heel strike. And then with female athletes, we have to consider that they have a menstrual cycle in which they're losing iron, so their iron needs are going to be higher. Folate and vitamin B6 are both important for energy production and can be lost in sweat as well. So if we're producing more energy and burning more energy during athletic competitions and we're losing sweat, folate and vitamin B6 needs are going to be much higher. Zinc is a common deficiency across all individuals, but it's especially important for healing, tissue growth, and immune function. So if there is any injury or illness in that athlete, zinc is really important nutrient. So you may all have heard of the female athlete triad. This is a term focused at female athletes, and it results from inadequate energy consumption. So the issue with the female athlete triad is that we found that it isn't all encompassing for the conditions that female athletes may experience if they are under consuming calories. So the new terminology that has taken place of the female athlete triad is RED-S, or Relative Energy Deficiency Syndrome. So that's what RED-S stands for. So instead of just, disordered eating behaviors, low bone mineral density, and menstrual disturbances, we see that there are a whole lot of other factors associated with this energy deficiency. Okay, so you see these psychological factors are going both ways between RED-S. So perhaps these disordered eating behaviors or restrictive eating are leading to this relative energy deficiency syndrome. The syndrome can also feed into psychological factors as well. So here you see this is what would encompass the female athlete triad, whereas the new terminology of RED-S is going to factor in issues with growth and development, endocrine, which would be hormonal issues, cardiovascular issues, and GI issues, as well as the immune system. So RED-S is more tailored to all of the conditions that may be associated with energy deficiencies, not only in female athletes, but something we really have to pay attention to in those female athletes. Okay, so we talked about how substance abuse may be more widely accepted among adolescents. So, cigarette smoking, alcohol, and recreational drugs, of course, can be some of those most commonly used substances. But I think it's important to just address that substance abuse is also related to disordered eating behaviors among adolescents, as well as depletion of vitamin and mineral stores. There's also all of these potential side effects as well. So again, if you're working in a school or working with adolescents, it's important to teach that it isn't just about getting in trouble by using these substances, but they can have real significant consequences to your body, especially among athletes who are trying to perform well. Iron deficiency, again, is one of the most common nutritional deficiencies among adolescents. We want to really pay attention with this in women or female adolescents because of their menstrual cycle. But vegan athletes or just vegans in general can be at greater risk of developing iron deficiency. So again, we're going to recommend iron-rich foods and vitamin C foods because this can help with the absorption of iron as well as supplements for iron. So I previously mentioned that hypertension and hyperlipidemia, which is on the next slide, are important conditions that we have to consider in adolescents. These are associated with cardiovascular health, and we treat both of these conditions with the DASH eating plan. So this is the dietary approaches to stop hypertension. We'll talk a little bit more about this eating plan in the adult chapter, but it helps overall with cardiovascular health. Diabetes and metabolic syndrome can also be present in adolescents. These are really rooted in insulin resistance that can be related to overweight and obesity. Okay, and then finally, I always like to touch on eating disorders and disordered eating behaviors in the adolescent chapter because simple dieting behaviors that are so commonly practiced among adolescents can really lead to these disordered eating behaviors. And I think with the connection in social media and all these influencers who have really strange eating behaviors can definitely influence adolescents when they're not even really realizing that they're disordered eating. So disordered eating kind of lies on a continuum in that one doesn't necessarily develop an eating disorder in one day. So it can start as just simple body dissatisfaction. I've talked about this and how our language is heard by the youngest of children. And so if we express dissatisfaction with our body, young children can hear that and they start to maybe judge their own bodies. So we see that it starts with body dissatisfaction, which may lead to dieting behaviors. Dieting behaviors may seem very harmless, but they can really lead to disordered eating behaviors in that dieting behaviors may become more and more restrictive, especially if an individual sees results that they think are good and positive by an inappropriate behavior like a severe calorie restriction, or they may become more and more dissatisfied with smaller, more healthful changes and become more restrictive in their diet, and that is considered a disordered eating behavior. This disordered eating, which can go unrecognized, people can think that it's normal. That is what leads to these clinical eating disorders that we can diagnose. So the most common types of eating disorders are binge and purging eating disorders. So binging means that someone may eat a significant amount and to the point where they feel like they have to purge. And it's important to understand that purging doesn't just mean self-induced vomiting, but it can also mean use of laxatives. Anorexia would be primarily a low energy consumption. So This doesn't mean that they're just very specific about the foods that they consume. There's actually another type of eating disorder or a diagnosis that is more like of the orthorexia type. But anorexia would primarily look at total energy reduction. Bulimia nervosa is more of vomiting after meals. It can also include laxative use as a purging mechanism, but with bulimia nervosa, we don't always see a binging episode that precedes the purging behavior. And then binge eating disorder, this can be a condition in which an individual consistently binges on foods or during like similar periods of time, maybe stress, but these wouldn't be followed by a purging behavior. So with eating disorders, we definitely want to address them and treat them appropriately. So those professionals who are qualified to treat eating disorders are highly regarded. And depending on the severity of the eating disorder and the patient's ability to understand how complex the eating disorder is, the treatment can look a lot or look very different. So there can be outpatient treatment, there can be day treatment, and inpatient treatment as well. So the overall goal for eating disorder treatment programs is to restore a healthy body weight, to improve social and emotional well-being, and to normalize the individual's eating behaviors. So there are a lot of components to a good eating disorder treatment program that, of course, are going to include these goals, but they may also include psychotherapy, nutrition education and counseling, as well as family and group therapy. So I have a lot of resources if you feel like you may be experiencing some type of disordered eating behavior. I don't like to talk about this and not offer any resources. So if you feel like you want to talk to me more about that, I'm happy to do so.